Hello, it's Bill, the knee pain guru, and welcome to the Ask Dr. Beck show. Good morning, Charlie.
Good morning, Bill. It's our baker's dozen today.
Number 13. All
Number
right.
13.
So, how are you? What's happening? What's been going on for you this week?
Well, I guess the world's proceeding forward. As you can see behind me, there's a cabinet that's been moved out from the wall. We're putting a closet where the cabinet was.
Oh,
and so that's what's new in the room today.
Okay.
Yeah.
Got it. How are the how's the? I know they had pushed out last week. We talked about the building of your center there in Indianapolis, and
Yep.
You needed a windows, and they don't have windows. They're somewhere out floating on a ship.
Don't have windows. Won't have windows until mid-December, and I'm not holding my breath for that one.
Okay, got it. Yeah, there's some stories we can talk offline. What I've been hearing around that. So
Yes. So our building is now what is actually in stock, and do we like it? If we don't like it, the answer is we probably still do like it because it's in stock.
Like another replacement.
Or anything that we're looking for, cabinets, floors, countertops, you name it. Because it used to be, let's say a few years ago, if you wanted something, you might special order. It might take a few weeks to get there. No big deal. Now, if you special order it, it might take years.
Oh.
Yeah. And we can't wait that long.
Got it. And will you have just the one location, like where
Yes.
you're at, and you'd close down the other one in Indianapolis?
Close down the other office in Indianapolis, yes.
Will you be having classes at this location as
Yes.
well? Is it large?
We are setting up a big space that we can kind of convert into a classroom really easily, and should be able to hold about 20 people.
Nice.
Mm-hmm.
We can chat about that.
The wheels are turning, yes.
Excellent. All right. Awesome. Well, we have no ETA on that, but we will definitely keep everybody posted as
exactly
develops. Have you taught any classes recently?
The class in West Virginia a couple of weeks ago, but nothing since then.
Yeah, I think we talked about that. And any trends in patients that you've been working with this week?
Huh. I could answer your question and say yes and no. Mm-hmm. No new trends, but I'm beginning to get deeper understandings of things I have seen since day one.
Okay.
So, I can talk about that if you want to.
Yeah, that'd be great. I'd love to hear about, because I think that's a valuable skill to learn for anybody, like in pain, out of pain, studying, body worker, aspiring osteopathic physician that specializes in manual manipulation.
Right. Or person inhabiting a body on planet Earth.
Yeah, that evolvement of ideas and concepts that you think you know it, and then you learn more, and then it changes.
Right. So let me start with, we'll call it ideal, and then I will discuss ideal, and then wherever we all fall off of ideal. So in a perfect world, you are born into a loving family and a loving environment. Okay. You start off feeling supported, and your nervous system recognizes that support. And because of that, your nervous system is not triggered, and you develop, we'll call it optimally. Okay. So whatever it is that your blueprint is, you fulfill your blueprint. That we'll call optimal. Now, most of us, probably closer to 99.9% of us, don't hit optimal. Something is off. We're either born into a family that might love us, but we don't perceive it as love. Mm-hmm. We might be born into a situation where things are stressful. Not enough money, not enough space, whatever it is, there's not enough. Mm-hmm. And then we may have trauma. that trauma can start in infancy, or you might grow up in a loving family and have trauma afterwards.
Mm-hmm.
So if we set karma aside, and because there are some people who believe that all this stuff we kind of preordained in some contract that happened prior to our coming into existence on the planet. So let's set that aside for a moment. When trauma happens to us, we have small trauma. So, you walk past something and you go, oh, it feels really nice. And you slice your finger just a little bit. That's minor trauma. If we're young, it might bring tears to our eyes. If we're old, we might shout expletives. But you let it bleed for a minute. You put a Band-Aid on it. You stop the bleeding. Maybe put an antiseptic on it and it heals. Mm-hmm. It doesn't cause lasting physical wounds, and it typically doesn't cause lasting emotional or psychological wounds.
Mm-hmm.
Now, enter the scenario of having bigger trauma. So you go to touch whatever it is, and the building collapses on you. You didn't know it just was going to do that. So now it's big trauma. Mm-hmm. You have physical things that have happened in your body. You have emotional things going on. And if the scenario that we just talked about exists, now coming through your life, you don't want to touch anything at all because it instills in you a fear.
Mm-hmm.
Okay, so that's the scenario. Well, then society tells you to keep moving forward. It's irrational to be scared of touching everything.
Mm-hmm.
And so your body is telling you one thing. It's telling you how to keep you safe. Well, we're going to stay safe if we don't touch anything. And society is telling you you have to touch everything. So what I see in my practice, and it's interesting because I went through medical school with Harry Potter. When the books were being written was when I was going through medical school. J.K. Rowling wrote a book every year. And so literally Harry and I went through our education together year by year, just the way it worked out. And when I was reading those books, they made a lot of sense to me. Going through osteopathic medical school was not so different from being a wizard compared to traditional medicine. And in the books, they talked about Horcruxes. So Voldemort, the primary antagonist in the series, in order to keep himself from being able to be destroyed, he literally fractured off parts of himself and put them in objects.
Mm-hmm.
And you had to destroy the object to be able to destroy Voldemort. That was the gist behind it. And interestingly, well, I wouldn't call them Horcruxes, but when we're in these big trauma, what happens is in order to keep our souls safe, we will fracture part of our soul.
Mm-hmm.
And that part typically takes the trauma. We take what's left and go through life thinking that we're complete and whole.
Mm-hmm.
And it takes someone who has different skills than I can spot them, but it is difficult for me to work with someone and get them to reintegrate. But, having that, being able to find someone who can help you find those places in you that were so wounded that they fractured off to keep you safe. Mm-hmm. And in order to be whole again, you have to find someone who can create the safe space, help you heal that wound and reintegrate that part of your soul.
Mm-hmm.
And I don't know if I'm just more aware of it, but I'm seeing it more and more frequently.
And is this, like you were saying, there's another person that would have a skill set that you may not possess or not as developed or care to work with in that direction. How, the question is more like the how valuable is the getting the person's structure in place to this as a supplemental or additional component or therapy that a person that has this fractured experience in their psyche, in their being?
I see it as very valuable. So I have a few patients in my practice, and I'll share what I can, who during their childhood were ritualistically abused. And sometimes it was family, sometimes it was family, clergy, other doctors. I mean, I shake my head and just wonder at how we can be so mean as human beings. They're telling me their story. They obviously have reached adulthood. But what happens is, as the patient and I work together, and I start to get their structure improved, then what I begin to see in them is they're able to go deeper in their process and heal more things. The way I understand fascia, and I don't know if the technology is still headed in this direction, but quartz crystals, if you bend them, they change the conformation of where the atoms sit in relationship to one another. So if we take A configuration where the quartz crystal is not bent, and then B, the configuration where the quartz crystal is bent to a certain place, doesn't matter. It basically holds different energy.
Right.
And there was talk of being able to use this as a type of computer hard drive, where the configuration in configuration A holds a certain piece of information. And when you move it to configuration B, it holds a different configuration, a different piece of memory.
Okay.
They were talking about being able to make hard drives that were very, very small and would hold terabytes of information just because of these mechanical changes that they would make. And the fascia of the body works exactly the same way.
Oh, okay. Gotcha.
So when you are in an accident or have a trauma, literally the way your body is in space stores the energy of the trauma. If you move into a different pattern of motion, so you raise your arm, you move your eyebrows, doesn't matter what it is, but something different, then that old information may not be easily accessible, and you can store new information. So there are a number of different ways to do this, but somato-emotional release, where basically you're looking to put the patient back into the position they were in during their trauma to help them release it. And so that's the fascia of the body works as this hard drive, if you will, storing information such as emotions. And so when you start to work with folks now, so trauma happens in an instant, typically. So you get punched, for example, right? It takes milliseconds to a second. Then the body's change to that trauma can take minutes, hours, days, months.
So there's a follow-on, like a domino effect.
Like a domino effect, absolutely. And so when I begin to work with those folks, what I have to do is try to get their body to where it's, first of all, healthy enough to handle the change. And then you begin to kind of work backwards in time in whatever way the body can handle. And trauma then comes up. It's rare that it happens in my office, but we get them into a place where their body's moving. It starts to release energy. And then I make sure that they have a good support system so that they can work with those folks and heal whatever comes up for them emotionally, spiritually, psychologically.
Okay, we have some people on the line that are watching. If you have questions, please enter those in the comments section or the live chat. Dr. Beck will be happy to answer your question. Make sure to give the video a thumbs up, like and subscribe to the channel, turn on notifications for future videos. Okay, I said that. Now I'm going to try to stay focused on what I wanted to ask you.
All right.
Okay. is the reason why in working with a patient, and when you work with a patient, and you said there's a few instances of emotional stuff that come up in your office, is that what would you attribute that to? Because from my experience, there's been with body work, working with you, working with other practitioners in osteopathically based styles of body work, there has been, I'd say, pockets of things that have been released that all of a sudden it's like, why am I so pissed off? Why am I so upset?
Right.
What would you say is the difference, or can you attribute a difference to emotional releases sometimes, not emotional releases in others?
Multifaceted answer to go along with your question.
Okay. They usually are.
Yeah. One of the things that I have been able to articulate recently, and maybe I've recognized it for a long time, is that, first of all, our individual human bodies are incredibly smart. And if we take, let's say you and I would be seeing the same patient.
Okay.
But you and I have different life experiences. You know what you know, and I know what I know, and they may overlap, but it's very rare that they're identical, even if you and I had gone to the same school all the way from childhood on. And so what happens is when you walk up to the patient's body is going to show you, A, what you can treat, B, what you can understand, and then you bring in wherever you're at in your life. If you're going through big, let's say you're able to do a lot of physical stuff, then the patient's body is going to show you the things that might need physical work. If you're not so in tune with your feelings, even if it showed you those things, you wouldn't see them because it's not where you're at in your space.
Got it.
Okay. Then let's just say, for example, I walk up and I'm not feeling good physically, so I'm probably not going to see the same things that you would see. But I might be really going through, let's say, spiritual journey. And so that patient's body is going to show me something that I might recognize as, oh, you need help spiritually. And I just happen to be on the path that allows me to be the thing that allows you to change. And so that's why each of us as a practitioner, and I mean, we can go all the way through the medical profession, nurses, doctors, massage therapists, talk therapists, doesn't matter. All of us are going to have our skill set. We're going to have things that we're super good at, things that we're average at, and things that we just are terrible at, almost no matter how much we try. So if you're not getting someone to the place they want to be, it's important to find another practitioner who just has a different skill set, who can put different eyes and a different thought process with that patient, and then help the patient potentially get better.
Yeah, I hear you. I hear you on that one. That's really good. I did come across a question here. It looks like it came in a little bit ago, and for whatever reason, I missed it.
Okay.
It was from Kathy. This is on the Ask Dr. Beck link of the Comella Foundation website. Kathy writes, what can it mean if you have muscle spasms in the leg where you have knee arthritis? Shows degeneration of the... Oh, we answered this. I just didn't tag you. My bad.
Okay, good.
Anyhow, that was all I had come across. Let me see. Hold on a second. Okay, here's one.
Okay.
Says, I just have one question. It says, does cartilage heal itself slowly, or does it not heal at all? I'm suffering from Chondromalacia Patella, grade 3, age 32. Can I heal my cartilage naturally?
Tricky question to answer.
Yeah.
Okay. So if we go from the traditional Western medicine standpoint, cartilage, which basically has no blood flow, doesn't heal. That's their thought process. It doesn't mean it's not bathed in nutrients. It doesn't mean it cannot heal. You just have to approach it from a different aspect. Mm-hmm. So Chondromalacia Patella. What we have is a wear pattern that's developing in the kneecap. So the first thing you've got to do is get that kneecap to where it can track using fractal physiology. So it's not wearing that same hole. Mm-hmm. That's the biggest thing you have to do. After that, yes, it is my clinical experience and what I've been taught that with the appropriate injection therapy, prolotherapy, platelet-rich plasma, stem cells, exosomes, that you can get that cartilage to heal.
Yeah, I think we covered that. We went in extensively on getting the structure in place, and then structure governs function.
Yep.
Getting the structure in place and then using those other Western medical model injections, stem cell, prolotherapy, PRP, that kind of stuff, that would be able to help whatever is going on in the knee to be able to heal.
Yep.
Cool. Okay. Well, that's what we got for today.
Awesome.
Well, thank you, Charlie. Appreciate
Thank you, Bill.
Let's see. Oh, wait a minute. Someone typed in a question here. Can osteopathic treatment help chronic stenosis of the lower lumbar spine and cervical spine?
Oh. So I'm going to have to take the word help and break it down. Can it help? Absolutely. But we've got to understand what stenosis is and what it does, and then what we can do medically and what we can do that's outside of traditional medicine. So stenosis just means narrowing. And so basically what you have is, let's make it simple in creating a visual. You have a soda straw, and we'll make it one of the Wendy soda straws because they're a little bit bigger around. Mm-hmm. Inside the soda straw, you have a coffee stirrer. Okay. And so the soda straw is the actual bony part that holds space for the spinal cord. Mm-hmm. The coffee stirrer on the inside is your spinal cord. Okay. Mm-hmm. And that spinal cord, as you can imagine, because it's smaller, is able to move inside the bony part that holds space for the cord. Mm-hmm. Stenosis means narrowing. So what happens, for reasons that we don't really know, is that the bony part that the spinal cord fits in, the spinal canal, mm-hmm. gets smaller. Once it gets to a place that's small enough where it puts friction onto the spinal cord, mm-hmm. the spinal cord then begins to swell. It swells into a space that is smaller than normal, and now you begin to have symptoms. Okay. Spinal stenosis, cervical stenosis. It can happen anywhere in the spine. Mm-hmm. So from a Western medicine standpoint, what we can do is, but remember, this is tricky because we're with these nerves that can't be really damaged, is we can do surgery, remove a flap basically of bone, very gently clean out the stenosis, giving you a bigger cavity for the spinal cord to fit in, mm-hmm. and then put the flap back on the bone, and hopefully you heal, mm-hmm. and you heal better. Mm-hmm. The only problem is that they found that when the bone regrows, the stenosis reoccurs.
Okay.
And so it is something that can be done, but it doesn't always have a super awesome outcome. Okay.
Mhm.
So then what tends to happen, and this is how you can kind of define stenosis, when you bend forward, so you were going to touch your toes.
Mhm.
What you do is you start to spread, it stretches your spinal cord just a little bit.
Okay.
The stretching causes it to get more narrow,
Okay.
which means it fits easier within the stenosed part of the spine.
Okay.
Okay. So basically, here's your quick way of figuring out if you have stenosis. When you go to the grocery store, do you lean over the cart? If you lean over the cart, what you're doing is you're stretching your spinal cord.
To make it less
That's
painful.
likely that you have stenosis. If you sit in a chair and have to be on your elbows, on your knees, stenosis. If you can't sit up straight, stenosis.
Mhm.
Okay. So that's your background. There are two ways to work with stenosis, and they theoretically could go together. One is to fix the bony part, make the canal wider.
Mhm.
The other one is to fix the inflammation in the spinal cord,
Mhm.
making the spinal cord back to normal size, but in relation, it's smaller than being inflamed. Okay. And that latter one is the one that I do. So it's very interesting. What we use if you have brain swelling
Yes.
is a specialized sugar called mannitol, naturally occurring, and we put it in your IV drip. It basically works its way into your brain, takes down brain swelling.
Mhm.
That's the only place we use it. We don't use it anywhere else for nerve swelling,
Mhm.
even though it does exactly the same thing.
Mhm.
So if I remember the story correctly, there was a Civil War surgeon by the name of Silas Weir Mitchell who ran a 400-bed rehab hospital at a time when if it got shot, it got cut off
Mhm.
because we didn't have the surgical techniques. Okay.
Right.
You look for the patch of the uniform. If you could find it, you might live. If you couldn't find it, you were probably going to die of sepsis just because that's the way it worked. So Mitchell ran this rehab hospital, and he had a lot of people who came in with phantom limb pain. So leg got shot off. They thought it was still there, and it hurt. Well, there's nothing to work on. There's, air where the leg was supposed to be.
Right.
And what Mitchell figured out, and I don't understand in my brain how he was able to do this, but if he took something called Elixir of Morphine. Now, they don't make it anymore, but basically it was morphine and sugar.
Mhm.
And if he injected it on the surface nerves of the skin, so these
Mhm.
are just barely under the skin, it would take away their phantom limb pain. And after a couple of treatments, their phantom limb pain would go away and stay away.
Is surface nerves of the skin at the closest part where the limb was cut off?
I'm going to say for the most part, yes. Sometimes it was different
Okay.
because your surface nerves are going to be in a different location than mine. Everyone's surface nerves are kind of unique to them, their own pattern.
Okay.
So you had to figure that out. But basically, he wrote a 400-page book, which nobody's ever heard of.
Wow.
There was a guy in New Zealand who read the book, started working with his patients, and what came out of it was neural prolotherapy. That's what he called it, where you can take a sugar solution. Now it's 5% dextrose in water.
Mhm.
You inject those surface nerves, and the nerves start to decrease in their swelling, and the pain goes away.
Mhm.
You can take that same principle and use it with the spinal cord. So that is what I do with folks.
Mhm.
And I would say clinically 85% success,
Mhm.
which is pretty good. I mean, all you're doing is injecting sugar, and it takes 2-3 minutes for it to kick in. And then once it kicks in, your pain and discomfort, the symptoms basically start to go down because we are decreasing the inflammation in the nerve.
Mhm.
And that is my approach to stenosis, as well as getting all the structures moving so that hopefully is not creating as much inflammation as was there before.
Mhm. Okay. Lots of questions. I think we got a thumbs up from Kathy. Okay. What causes the narrowing of the spinal column? Like what is that? Is that kind of like a bone spur type of scenario, like a calcium buildup on the inside of the spinal column?
That's a very good guess. I mean, when I went through medical school, nobody knew.
Okay.
It happened. That's all we knew.
Okay. So that's one question, because it's like, is the bridge getting raised, or are we lowering the river? And the swelling in the spinal column, how much is attributed or contributed from diet? Like, can we look at inflammation that's created systemically in the body because of diet or lifestyle kind of things that contribute to systemic inflammation, contributing to the swelling of the spinal column?
So I'm going to have to say yes and no.
Okay.
You can have generalized swelling, and the cord, every nerve in the body, for example, may swell a little bit.
Okay.
Okay. But typically this is, at least from what I've been able to put together, it's a friction thing.
It's a friction. Okay.
So they did a study in rats, of course, because you can do that, where they dissected out the sciatic nerve. That's the one that runs through our butt.
Sure.
Now,
It's medical.
all they did, and it was the same in the mouse, right? All they did was dissect it out.
Right.
Then very gently, they lifted the nerve. They put a little piece of fabric underneath, and they folded the fabric over the top of the nerve. Didn't tie it, didn't do a thing. So literally the weight of the fabric is resting there. They went away for a short duration, 15, 20 minutes. They come back. The nerve has swollen to twice its original size.
Okay.
See? So it's just that little bit of pressure. Nerves like to be free floating.
Okay.
If they're not free floating, that little bit of pressure causes the inflammation.
Mm-hmm.
And then if we're in the case of stenosis, the inflammation now perpetuates the friction on the nerve, and we're in kind of a downward spiral. We can never get out of having a nerve that's small enough to move in the space that we have.
Got it. Okay. That makes sense. And is stenosis typically going to be throughout the entire spine when stenosis forms, or just in maybe?
No, it's usually one or two or three vertebrae.
Oh, and okay, here's another question. Do you find it that there's going to be restriction, some sort of restriction in those vertebrae, like a structure thing? Does it correspond with the vertebrae that has the stenosis?
Interesting, and I don't know that I have enough information to be able to give you a good answer.
Okay.
It would make sense that it does,
Mm-hmm.
but I don't, in my mind, I've never found a patient who comes in with stenosis and I put my hands on it and I go, aha, that's where it's at.
Okay. Okay. I'm happy.
Cool.
I think Kathy's good as well. Okay. We're done with the questions.
Awesome.
Charlie, thank you so much. Make sure to give the video a thumbs up, like and subscribe to the Comella Foundation YouTube channel. Please share this video with your friends, family, and loved ones. Next week, same time, same station. If you have questions, please type those in the comments section, or on the Comella Foundation. You can go to the Ask Dr. Beck. Go to that link and type in your questions there. We'll read them live on the air next week. And there we go. Okay.
Awesome.
There we go, Charlie. Thank you so much. Have a great week. And
You too.
Looking forward to next week.
Yep.
Okay. Thank
Send in
you.
your questions.
Okay. Bye.
All right. Bye.